Happy Friday, everybody! Welcome to the internet's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, the explosion of semaglutide, also known as Ozempic, what it means and how it may affect plastic surgery. Next, there's a fungal outbreak in plastic surgery clinics in Mexico. We're going to tell you what you need to know. And finally, Sarah wanted to hear all about the brain-eating amoeba. This one's actually pretty interesting, and it's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for joining us today. We really do appreciate it. Please hit that like and subscribe button and leave us a comment. We want to hear from you. I'm your host, plastic surgeon Dr. Bruce Hermann. With me, as always, is the wonderful Sarah.
Hi.
Hi, Sarah.
What's
In the
up?
box, we got Travis. What's up, man?
Hey, what's happening? What's happening?
Doing good. So, for those who watch the show regularly or live or look for the episodes, you might have noticed that we didn't have an episode last week. So, we actually did an episode, but apparently there was a catastrophic equipment failure, right, Travis?
Yes.
So, I mean, things happen, and I'm really interested to see how much better we do the show, because we're doing the same show. So it's like the second time around, is it going to be better?
Oh God.
It might
be worse.
It might be worse.
I might not have any questions to ask.
I know. Well, and it was just funny. I'd almost like to see the shows side by side to see how different they are, because we have a minor script. We don't really have a script or teleprompts. We just talk about the topic. So
I do still have the old show, so that could be a possibility. We could have a side by side.
I don't think we can hear it though, right? That was
No, there's no.
We'd have to get a lip reader in here to
Absolutely.
We should have just talked over it.
Oh my God! Can you imagine? It would be like one of those bad Japanese movies where,
or like the NFL ones. You know what I'm talking about, Travis?
Yes, I know what you're talking about.
That would be kind of
Those are
fun,
the
honestly. If we could
funniest.
have done that and wait, I think I said this here, and
We could have did a voiceover.
that would actually be pretty entertaining. But I don't know. This seems like the safer route to just maybe
I
read the
guess.
show. I'm really interested to see how I do this time. I mean, am I going to do better? Or I don't know. You guys are going to have to judge me at the end. Honestly,
I'm sure you'll do better.
Think I'll do better?
Yeah.
I don't know. The thing is when I prep for the show, it's all front in my brain, and it's been a whole week, and I mean, I'm sure I can figure it out. But also, Sarah and Travis, we have a couple guests coming up. This will be new for us. So
yeah, that's our first.
yeah, we have a girl who's really big in the social media and the marketing part of it. We're gonna have her on, and then and I don't want to say their names until I'm sure and they're committed. But there's another girl that does a lot of jaw contouring surgery in the Metroplex that has expressed some interest coming on. So we're trying to get all that nailed down, and we're gonna have to bring out the couch for that.
Yeah.
Sarah, do you mind sitting by the guests? Or, I mean, I guess
don't
you or
care.
I could sit on the couch, or maybe you sit by the guests, Sarah. What do you think?
I don't know.
I don't know. We'll have to take a poll towards the end of the show to figure out where's the guest gonna be.
I don't know.
Travis, do we
Maybe
have enough
should sit
camera
at a
for guests? I
table.
mean, I'm sure we can figure
Oh
that out.
yeah, absolutely.
Are we gonna do 4? Is it gonna be a 4 thing up there instead of the 3 like this normal?
So we'll have to get it all mapped out logistically.
Dude, you better get ready, man, because it's coming.
I gotta make sure I got enough microphones.
I know, dude. All
It's the
right.
biggest issue.
So I can't even remember what we talked about in the prequel of last. I think we talked about the aliens. That was kind of a thing.
Yeah,
back then.
I have an update about that.
Oh, you do? Okay, so last
Yeah.
week in the intro part, we talked about the aliens from Mexico.
Mexican aliens.
I haven't heard anything, so tell me, what's your update about the Mexican?
Okay, so
Are they-
their scientists have X-rayed them and done tests on them. They are saying that they are not of this earth,
Really?
but they haven't yet given access.
not sharing the
to
data.
International scientists. So
I wonder why this isn't bigger in the news. It was a really kind of a small blip. I think people aren't taking it
but
seriously.
at the same time, why would Mexico make that up? You.
I don't know. Maybe they're looking
Why
for
would you
attention.
take this to the government and then
I don't know.
And I'm is this a movie stunt? What is this?
You may have to give me a full report next week about the. I don't really know that much, except I was saying last week. I was scrolling through social media and I saw the little the cast of the aliens, which they
look like powdered.
Yeah, it looks
candies,
terrible, man.
Like
it's so
powdered
bad.
Halloween candy or something.
Which almost makes it more realistic that they don't really look that great. Because I mean, aren't they supposed to be really old or something?
Yeah, and then one of them's supposed to be like pregnant. They found
A
like,
pregnant
eggs
alien?
in it.
Oh
Yeah,
my god, this story gets even better.
in the X-ray.
I'm gonna have to do some or maybe you should do the research and give us like a full report.
Okay.
Can you give us a full report on that?
I love aliens, so sure.
I really am intrigued by that stuff as well. I saw
don't know
those
how
little
much
guys and I was just like, I don't know.
I mean, I think a lot of scientists are like, "What is this?" That like it looks too fake for it to be real.
It does look too fake.
So I think.
Which
they're
almost
like,
makes it more believable, right? Because I mean, in this day and age, you can obviously make a
but
really.
like when you think of like a human skeleton, or like a mummified skeleton, are their arms like straight out like how their arms are? Have you seen pictures of them?
Yeah.
They look like.
Yeah, that's why I looked at it and I was
like,
like, next. And I'm moving on. Okay, all right. Well, maybe next week we'll talk about it. We'll do a second.
I was listening to a podcast and they were like, it looks like the alien's face was like stuck in a tuna can for its entire life or something because their faces were like.
all smushed.
Yeah.
But that might be how they look. We don't know.
Yeah.
All right. Well, maybe next week we're going to talk about aliens again. That one episode we did where we talked about the alien report from Congress is one of my favorites. That was so funny. I was laughing so hard. Just because it was, it's just a different topic. So, and we don't know anything none of us know anything about aliens. So we're just all kind of like, what?
I loved it.
Good times. Okay. All right. Let's move on to some topics we do know about. And some of these topics you guys are going to know about because some things we actually talked about. So the first topic I want to talk about today is the explosion of semaglutide, also known as Ozempic. And it is an explosion. It's been kind of crazy how many more patients I've seen coming through my practice that are on semaglutide. Okay, so when I say semaglutide, are you guys familiar with that term, or do you guys know it as Ozempic?
I know it as Ozempic.
You know, what about you, Charles? Or do you know any of the terms?
No, so I know it is Ozempic.
Okay, all right. So
except for from like about a week ago when we mentioned it.
last week when we did the show. Yeah.
I don't know if my my FBI agent that lives in my phone, like if they heard something, but like I got an ad on Facebook for Ozempic.
After we did the episode?
Yeah, like
Dude,
2 days
how messed
later.
up is that? That
had
happens to me
never
all the time,
gotten-
and I don't like that stuff.
I've never gotten an ad for that
like
kind
Big
of
Brother's
stuff.
listening in,
I was like, what is that?
and you're like, wait a second.
Why are you doing this? Like I've
were just talking
never,
about
I
that.
don't think I've ever looked it up. Like
I'm telling you, man, the phones they're listening to you.
it's weird.
Yeah, crazy. So semaglutide is just the generic name for Ozempic. Wegovy is the other kind of brand name, I think. I think those are very similar. So if you guys don't know about semaglutide, this is a medication that initially was created for diabetes. And one of the side effects they found in the people that were taking this drug for diabetes, they start to lose weight. And so the mechanism of this is that it's a glucagon-like peptide agonist. And so in very generic terms, that means that when you take this drug, it stimulates this receptor, and that receptor makes you feel full.
Yeah.
And it also affects how quickly your stomach empties. So when this receptor gets stimulated, you don't want to eat. And it's actually very, very effective. And this medication is given by an injection. So it's an injection that you can give yourself or your doctor can give you, and you do it once a week. So it's super easy to take. You don't even have to remember to take a pill every day or multiple pills a day. And it has some very mild side effects. This isn't a drug that people generally have to stop taking because it's too bad. It's mostly GI stuff, things like, maybe some diarrhea or constipation, or maybe I feel nauseous. But in general, the side effects are pretty mild, and most people don't report them being significant enough to alter them taking the drug or not.
Yeah.
Do you guys know people that are taking this? I mean, with me.
I know a handful.
We take, these intake sheets of people come to our practice, so we know when people are on it. I see tons of people on it, but do you have friends that are on it?
Yes.
You do?
Yeah,
Like a lot?
my
Or
sis.
just, huh?
My sister.
Oh, your sister's taking it?
Yeah.
Is she? Oh, so how long has she been taking it?
For a while.
Did I ask you this last week?
Yeah, for a while.
I'm having deja vu. This
a
is
little.
really
I
weird.
think she's been taking it for probably a little over 6 months.
Oh, really?
She's lost almost 40 pounds.
Whoa, that's crazy.
I was talking
Man.
to her about it maybe last week, and
Yeah.
I was asking her how much they increase her
Right. How much she's
dosage.
taking, yeah.
I've already forgotten what she said, but
Yeah. Good, excellent.
woo. But it's very small. It's really, really
small dose.
small. And then her doctor also said that there's like a max amount that she's allowed to take.
Yes. Yeah.
But yeah, she's really excited and happy with the
I
results.
bet. Travis,
And,
do you know people
yeah.
taking Ozempic?
I do. I
Do
know
you?
at least 2 people.
Really?
That take it, and they're both women.
And you always wonder how many people are taking it that don't say anything about it, right? Because you can only imagine if, for how many people you know are taking it, there's probably 2 to 3 times that many that are taking
Yeah.
it and not saying anything.
I'm interested because you said like it slows down the rate at which it
Emptying.
empties from your
Yeah.
stomach. I wonder what's like the normal rate. Like a healthy human, like what is the normal rate of a stomach emptying?
I'm not going to be able to give you some very technical data on that, but I can tell you that when we take people to surgery, we like them to have nothing to eat or drink for 8 hours, because after 8 hours, your stomach really
Should be
is
empty.
complete. It is completely empty.
Okay.
If you're taking this drug, even up to 24 to 36 hours later after eating, there's still food left. So
See,
it
and that's
really
that would be the only thing that I would think would that raises my eyes a little, like my little eyebrows a little bit, is just because I'm like,
see, if you
is
had
that
Botox,
healthy?
you couldn't do that.
No, I need it
Well, think about it this way, there. So that's a great question, Sarah. That is food
because it's
being-
like unnatural for your stomach.
yeah,
to
but
have
think
that
about it. Like,
food
where
in
does the
it for
food
that long.
go after it leaves your stomach? Well, it just goes into your intestines, and
then
the same thing
out the
happens. It sits
toilet.
around there, and it kind of slowly, goes down the line and
Yeah,
gets absorbed
but
or not.
yeah, I was just thinking about that because I know your stomach has like acidic stuff in it, and I don't. It's like I wonder if that like causes.
I mean, that's a great
Stuff.
question. We're not seeing any significant kind
Yeah.
of side effects as of yet, and it's been out now for a few years. So,
Yeah.
great question. But really,
I
to
wonder
this
about
point,
like acid reflux or something.
I mean, that is one of the side effects they talk about is mild reflux, but once again, not something that's really.
One question that I do have.
Okay, bring
like,
it.
So
I hope I can answer it.
how long, I guess, like, is there an expiration period on, like, when people take it? Because you said it's been out on the market for a couple of years. Is there an expiration period where, like, okay, after like 5 years, it probably doesn't have any negative effects, and like,
For sure, man. Like, this drug gets out of your system pretty quick. That's why you have to take it weekly. I mean, weekly is a long time frame for a drug. That means that the mechanism of action or the half-life is actually longer than, say, like, your blood pressure medications, which you got to take every morning, right? But that doesn't mean that it stays in your system for months and months. I mean, when we're talking about surgery and making sure that people aren't going to have issues with having food in their stomach in surgery.
Yeah.
I think the current stipulation is you have to be off of it a minimum of a week, which means that after about a week, it's kind of out of your system. Now, there might be trace amounts left, but I don't think there'd be enough to affect you.
Gotcha.
Yeah, let's say. But the one thing that is very cool about this, and your sister results are showing this, because her results are actually better than average. So the average patient taking semaglutide or Ozempic at 3 months loses 6% body weight. So that's total body weight. So if you weighed 200 pounds, that'd be like losing 12. At 6 months, it's 11%. So that'd be like 22 pounds if you weighed 200. And then at 12 months, it's 15 to 20%. So your sister's ahead of the curve. I mean,
I think it's because she's just eating better too. Sometimes
Yeah.
she'll send
Well-
send me pictures of like her making like good like healthy smoothies and stuff, and I'm
Yeah.
like, good job.
And that's the thing is, and I say this about a lot of things, but it's always easier to lose weight when you're closer to your ideal body weight, right? As the saying goes, it's easier to make money when you have money. Well, it's easier to lose weight when you're not so far past where you want to be that exercising is really difficult. Also, too, when you start to lose that weight, it really kind of inspires you.
Yeah.
And then you start to eat better, and I'm sure that's probably what's happened with your sister.
Yeah, she has like that little fire under her
Yeah,
butt.
she does, man. That's great. I'm really happy for
So-
her. So the big question is, for at least our industry is semaglutide going to affect plastic surgery? And I think without question it is, and I actually see that already today because we'll get patients, even today, which I still think we're early in the semaglutide craze, we'll get patients that come in today that say, hey, I've lost weight, and then we'll ask, oh, how'd you lose weight? Did you do it on your own? Was it surgery? Because weight loss surgeries are still a thing, or was it semaglutide? That's a new question we ask now that we didn't ask a year ago. And some people are saying, I lost 30 pounds with, Ozempic, and now I don't have as much breast volume as I want to have, and I want implants, or they'll have extra skin around their tummy, and they'll want things like a tummy tuck. And we saw this whenever the gastric surgeries came out. Body contouring was not as big of a thing prior to the gastric sleeve, gastric band. Are you guys familiar with weight loss surgeries? Heard of those, right? Yeah, okay.
Yeah.
Yeah, so those started to really gain a lot of popularity when I was doing in in my general surgery days. I did so many gastric bypasses, I couldn't even count them. And then what happened was people started losing weight, and it was the same thing. Like,
Then they needed to tuck in.
They needed some tucks, so they needed some augmentations. The things that we see the most are breast surgeries, whether they be lifts or augmentations. Tummy tucks are really popular, and those have always been popular because of pregnancy. Not everyone sails through pregnancy like you did, or my wife's the same thing. She went through pregnancy and never really didn't change her that much at all. But a lot of people really get hit by it.
I have a feeling if I ever get pregnant again, I'll get hit.
You might. It's always hard.
Now.
Each pregnancy you have after the first one, like your chance of having, changes goes up.
Yeah.
But yeah, it's like we're already starting to see a little bit of that, and I think that the more people that take this and get results, it's just going to keep going. And so I think body contouring is going to be on the rise, which is already popular, but I think we'll see an uptick in things like breast lifts, breast augmentations, tummy tucks, arm lifts, where people get like the arm skin, and then thigh lifts. I think you're going to see an uptick in that. So I mean, it's good. It's the only downside of losing weight, right? Is it brings into question, does your body look better when it's a little bit heavier without the loose skin, or do you look better when you're thinner with loose skin? I mean, that's kind of a gray area question. I mean, it really depends on how much weight you lose and how much loose skin you have. But a lot of people lose the weight, whether it be from Ozempic or weight loss or just on their own, and then it's like, well, I have this, these changes I don't like. Well, I mean, that's where I come in. So.
Yeah, well, like my sister, I'm pretty sure that people that need to lose like a substantial amount of weight, when they get on that, that's like part of their plan.
Yeah.
Like my sister's is,
Sure.
I'm going to do this, and then I'm going to get my mommy makeover, and then I will be done.
I wish we could get insurance to cover these things. I mean, we'd have people beating down the door if they could.
Well, I hope that the insurance starts prescribing it to people that are like on that borderline of like becoming diabetic, and I hope it like decreases the amount of diabetes in the world.
It will, for sure. One thing that's happening and how this thing is kind of exploding is most people are not getting it through a regular prescription. A lot of people are getting it through compounding pharmacies. And so they're getting it really cheap, which is nice. So that's where we're seeing a lot of the people get it from. They're not getting like a prescription from their doctor to go to the pharmacy to pick it up. Like they're getting it through their doctor's office via compounding pharmacy, where they create it there as opposed to getting it from the pharmaceutical manufacturer, and then they send it to the patient. And we do that for a lot of drugs. I mean, a lot of the numbing creams we use for people that are getting lasers and whatnot are all compounded. That's a really common thing.
Another word for like off-brand?
What's that?
Is that like another way to say off-brand?
Yeah.
Or like generic?
It's generic, but it's also generic to the point that it's not created like at some big pharmaceutical industry complex. It's literally created in
so it's like
in the pharmacy.
Buying like the Walmart version of a product versus the name brand.
Yes, exactly. Yeah, and it also makes it really cheap because I don't know, I can't remember what the cost is on Ozempic if you get a prescription for it. I want to say it's.
My sister said it's very expensive, and she said she was lucky that her doctor prescribed it to her.
Okay, so she did it that way.
She was a person that was almost on the verge of becoming like insulin dependent. So
obviously now she's lost the weight. No.
Yeah, but she could still. She's probably still borderline.
Really?
Yeah.
Well, if she keeps up the weight loss, that should go away.
Yes.
Typically, it happens with weight gain. If people are heavier, they start to get pre-diabetic. So.
Yep.
Yeah. Well, it's interesting, how things have changed just in the past year or two. Like 2 years ago, nobody was talking about this, and now literally it's like not all we're talking about, but I mean it's a very common topic.
I'm getting Facebook ads for it.
Yeah, I know, right? Big brother.
It's so weird.
So if you out there have questions about Ozempic or Semaglutide or any of those, please leave us a comment. I'd like to know what you think. Also, leave us a like and a subscription. It really does help us moving forward to bring you guys a lot more topics. So, all right, moving on to the next one. So you guys might remember this, not just from last week, but from the spring. Do you guys remember when we talked about the outbreak of the fungal infections in Mexico?
Yeah.
Okay, all right. So
I think this is when we started talking about the aliens, because you was talking about Mexico.
Is that when we were talking about the aliens?
think
Oh no,
so.
it was in the beginning when I was like listing the topics in the beginning.
Oh, okay, yeah.
Right. So I wanted to revisit that because actually the CDC updated all their recommendations about that just at the beginning of this month. And there is more information because we talked about it right when it started to happen. And so for those who maybe didn't see that episode, what was happening was there were some plastic surgery clinics in Matamoros, Mexico, and it seemed that there was an outbreak of fungal meningitis. Now, breaking it down for you, you do not want to get fungal meningitis. That is very, very bad. Meningitis in general is bad. Viral is the least, least severe. Bacterial is the next one, which is, very, very severe, very dangerous, and fungal is the worst.
Yeah, anything to do with fungus.
Right, you do not want the fungus.
You don't want it.
You don't want the fungus. So we talked about it back in the spring when the data was kind of early, and we were just like, hey, just want to make you guys aware that there's these fungal outbreaks in Matamoros. Don't go down there for plastic surgery. But now there's a lot more information. So the CDC updated, and I think I got a slide up there. Travis, can throw that up there about the CDC. Yeah. So this is the article. If you want to go and look it up, if you type that into Google and hit CDC, it pulls up some really good information about everything that's happened with this fungal outbreak. So just to kind of, in a nutshell, this happened at the Riverside Surgical Clinic and Clinica K3, that is in Matamoros. The clinics ended up shutting down in May, so after we talked about this, the clinics themselves shut down. But the reason the CDC is still talking about this is that they've learned that the symptoms can actually pop up months after you've been exposed.
That's extra scary.
Yeah, that is extra scary because I think a lot of people are like, oh, well, I had my surgery in April, I'm fine now, and that's not necessarily the case.
A lot of them probably aren't from Mexico.
Right, that's exactly right, because all we know about is, here in the United States, are the Americans that went down to Mexico to get the surgery. And that's what really makes this scary, because we know now it's 185 U.S. residents were exposed to this, meaning there's 185 people that they know for sure went to those clinics. There were 33 confirmed cases of fungal meningitis, and of that, there were now 12 deaths, which is a mortality rate of 36%. So that's really, really high. You put that in perspective, things like flu, COVID, which have mortality rates that are less than 1%. 36% mortality rate is no joke. Like, that's very, very dangerous. So they have figured out that this was Fusarium solani. That's a fungus I wasn't familiar with, but I have a picture of it. Travis, show us the picture. There it is. So on the left, you have what it looks like on an agar plate, which is when they culture it. And then on the right is what it looks like under a microscope, which, I don't know. I mean, it's just kind of interesting to actually see a picture of it. Not that you would see that growing on your body. This is a highly resistant fungus. So some fungus is like, athlete's foot is fungus.
Mm-hmm.
And what is that one? Tinea something? You guys probably aren't going to be able to help me. So there's a name for that fungus, and actually is not one that's hard to get rid of, fortunately. Candida is another one that sometimes people get. And those are pretty easy to take care of. But this Fusarium solani is actually pretty nasty. And so now that the CDC has figured out that this thing can manifest months down the road, what they're saying is different. So when we talked about this in May, they were saying that if you don't have symptoms, don't worry about it. But now they're saying if you had surgery in Matamoros, especially at these two clinics, anytime this year, that you should go to the ER and get a lumbar tap, which is basically where they will take a sample of your spinal fluid, because that's where...
And test it?
Yeah, so meningitis is inflammation of the meninges, which is the layering around the spinal cord. Mm-hmm. And so, they're testing for that to make sure that you don't have a latent infection of this that's going to pop up down the road and potentially kill you. So symptoms, Sarah, tell me some symptoms of meningitis.
I already know them now.
You shouldn't say that. You could have looked really smart. You always look smart. Headache, that's right, yeah. That's a really important one. Fever, of course. The one that I always remember as a doctor when you talk about meningitis, because there's a lot of things that give you headache and fever, stiff neck.
Yeah.
Because it involves the meninges of the spinal cord. And so you get this really kind of, they call it nuchal rigidity, which is a doctor word for having a stiff neck that hurts to move. Nausea, vomiting, sensitivity to light, confusion, those are the other ones that pop up with meningitis. And like I said, this stuff is no joke. I mean, fungal especially, even the viral bacterial, I mean, you can die from this.
Right.
And so fortunately, it's not common. Meningitis is not something that tons of people are dying from, thankfully.
Isn't fungus the fungus from, this is not off subject, but kind of, but the fungus that's from this Last of Us, isn't that what causes people to turn into zombies?
Right, we talked about that. Yeah, we talked about the fungus. Yeah, what was the name of that?
Scientists have, in the beginning of that show,
right, we did an episode on it, the zombie fungus.
Yeah, and
what was the name of that zombie fungus?
I don't know.
No, it started with a C. clear something.
I don't remember.
Trovus,
but
the zombie fungus.
I thought that was interesting because it's like scientists are like, if there was something that could cause people to become zombies, it would be fungus.
Mm-hmm. That was a fun episode when we talked about that.
Because I guess fungus are just
Is it cordyceps?
more.
Yeah, that's it. Yeah, it's is this cordia something? Yeah.
Cordyceps or something.
Cordyceps, that's it.
There we go.
You nailed it.
Yeah, I knew it.
I knew it started with C. That's all I come up with.
I knew it off the top of my head.
I know. That's why you're back there in the box, man. It's like we don't forget stuff. We're like, Travis, help us out.
It's not like Google, just like.
It's not like Google's there. It's not like you have
No.
computers back there.
I heard them typing.
Click, 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 click. Is it this? Okay. So how do these happen, right? Because you're probably wondering, how do fungal outbreaks happen in a surgery facility? Well, it's due to contamination of either equipment or drugs. Either their lot of epidural anesthesia was contaminated, or the instruments they were using to do the epidurals were contaminated. Which that opens the whole, topic of don't go to Mexico to get plastic surgery. Mm-hmm. I mean, there's a reason that we don't do, epidurals for plastic surgery procedures. I mean, tapping the spinal cord does have risks. Not that general anesthesia doesn't, but I personally, knowing what I know, would never want to have a spinal tap unless I absolutely had to have it for some reason, because you're getting into areas that do not take kindly to infection, and this is a keen example of what can go wrong.
It doesn't feel great either, because I had to get one for my C-section.
For your C-section, yeah. And they do that so they don't have to do a general, right? I mean, there's a reason they do that in OB, and they're safe in general. So I don't want to scare people from ever getting a spinal. I mean, if you have to have, one for your pregnancy, obviously.
Yeah, I didn't go to Mexico. So.
You didn't go to Mexico, that's good. So I always like to kind of just recap really quickly why medical tourism or going out of the country is a bad idea, because it's still super common no matter how many times I talk about it. One, you have certification of your doctors. Certification in the United States sometimes is murky. In foreign countries, who knows? I mean, you really could have anyone doing your surgery. There's the inspection and accreditation of the facilities, and that's exactly what this is. Not that these kind of outbreaks can't happen in the United States, but they're exceedingly rare just due to the amount of oversight that we have. Mm-hmm. Language barriers are a big thing. I speak pretty fluent Spanish, but medical topics can be challenging. So even myself, where I speak fluent Spanish, I'm talking to people about medical topics, you sometimes can get lost in translation between native speakers and non-native speakers. Probably the biggest thing, or one of the biggest things too, I mean, they're all big things, but the poor doctor-patient relationship.
Yeah.
Because, a lot of times you're doing your consult like over the internet, and you don't meet your doctor until the day of surgery, and that just opens up people to having all kinds of problems. And then finally, dealing with complications.
So getting fungus in your brain.
Well, I mean, that's a big one too. In fact, I talked about this last week. So one of the girls that they interviewed that got this fungal infection that survived, thankfully, she actually called her clinic. Or no, she got online. She tried to call the clinic, couldn't get anybody. She got online to their Facebook group page. Mm-hmm. I was like, hey, I have this meningitis. Like, what do you guys recommend, about this? And they basically just kicked her off of it and blocked her. They were just like, yeah, sorry, you're on your own, which is crazy. But there's no repercussions.
No.
It's not like you can sue some clinic in Mexico.
Yeah.
So yeah, I highly encourage people not to go out of the country for plastic surgery. I know it's cheaper, but it can literally cost you your life. And if you have any complication whatsoever.
I wonder, can people sue that thing?
No, absolutely not.
Really?
No, how would you sue a Mexico clinic?
I don't know.
Yeah, it's impossible. There's just no way. I mean, you can barely sue clinics in the United States. You're not going to be able to sue a clinic in another country. Just not going to happen. So you just don't have a lot of repercussions.
They just shut down. They're like, nope, never existed.
They shut them down. I mean, they did. I'm sure the Mexican government, because who knows how many Mexican citizens.
Maybe that's where they found the aliens.
at the plastic surgery clinic. All right. Okay, meningitis, medical tourism. If you have any comments, please let me know. Leave us a comment. I'd like to hear what you think. Also, leave us a like and subscription. That does really help us. It really does. So if you have the time, please do that. So, all right. Sarah, are you okay?
Yeah, I just made myself laugh. That's fine.
All right. Sarah, you really wanted to hear about the brain-eating amoeba.
Yeah.
Do you even remember that? It's been a couple weeks now.
Yeah, I do.
I mean, it's actually super interesting topic.
I remember those little guys.
Yeah, the little guys, right? That's what they look like. I think
they look like pizza. The top one looked like pizza.
A little bit. Yeah, it does. Like, see the crust?
With legs.
Maybe I'm hungry.
Yeah.
It'd be cool if they
It's
were as
about
big
that
as
time.
pizzas. That would be very interesting. But those are actually pretty microscopic. So everyone's heard of this, I think, the brain-eating amoeba, right? You guys have heard about this before we ever talked about it. True? Yes?
Absolutely.
Yes.
Brain-eating amoebas, right. So I have to say, I had honestly never heard of this before I went to medical school. And then, of course, we were starting to read about this. Like, there's an amoeba that eats your brain? Must learn more. So this amoeba is called Naegleria fowleria, which is a free-living amoeba, which means it's a single-cell organisms. As you were talking about the other day, because the reason I brought this up, we were talking about warm water.
Yeah, because I wanted to take Avery to a lake, and then I saw something, like a BBC Instagram post about lake
brain-eating
water
amoebas?
having brain-eating amoebas.
Yeah,
I was like,
you're very knowledgeable about this, because you're exactly right. So these are amoebas that are commonly found in fresh water, which could be a lake, a river, or a hot spring, and sometimes even in like water parks if they're not properly treated.
Yeah.
So if it's like kind of standing water that's not getting all the chemicals it needs, but mostly found in freshwater bodies, but specifically warm ones.
Yeah.
Yeah.
In the South, for sure.
Right. Well, and yeah, in the South, because the water temperature stays warmer longer. So this is a thing that we commonly see in the southern United States. However, it is found in all freshwater bodies in the United States.
Right.
It's just more prevalent in the ones here. And scientists have actually tested the waters of bodies of water that resulted in an infection of this. And they found that generally, in all cases, the water temperature was greater than 80 degrees.
Yeah, that's pretty warm.
It is pretty warm, and so you're right. And there, like for example, I used to spend my summers up in New England, and I don't think the water ever got that warm. It might be getting the 70s, but it probably wasn't getting into the 80s. Versus down here in Texas, water commonly is in the 80s.
Yeah.
I mean, so there is some ability to kind of predict where this may or may not happen. So how does this thing get into you? Does it get in your body?
Through your nose.
Through your nose, right. This thing goes straight up your nose holes, where it then gets access to your brain and causes all kinds of problems, most notably primary amoebic meningoencephalitis. Now, we just talked about in the last segment meningitis. So this causes encephalitis is very similar to meningitis, but it's the brain, not the spinal cord.
Yeah.
And this one causes a meningoencephalitis. And I think I have a picture of not the brain one, but the other one, Travis, the little guys on the slide. Is that there? Do you have that one? Yeah, there they are. So that actually is a slide from a tap of somebody that had this. And what's crazy is just how many of those little boogers are on there. I mean, this thing, when it gets into your around your brain and your spinal cord, just goes hog wild.
Does this brain-eating amoeba have a higher death rate than the meningitis?
Big time.
Yeah, like
Big
if you get it,
time.
like you're pretty much done for.
Yeah. So, and I'm gonna ruin the surprise because I'm gonna bring up that in just a second. But before we jump into that, I actually brought. So what happens? So it gets into your brain, and how it kills you? It starts to actually destroy your brain tissue, and that causes your brain to swell. Not to mention the problem that's eating your brain, and then you die. And I actually have a picture. So this is a trigger warning. If you don't want to see a brain, now's the time to cover up your screen. Because I have a picture of a brain that was taken from somebody that died from this. So, all right, we're going to throw it up. Trouble, show up that brain. Yep. All right, so there you go. This is looking at a brain. It's the underside of the brain. That little kind of white dot in the center is the spinal cord, which has been cut. And the arrows on the left side are the frontal lobes, which is where you'd expect to see this, right? Because it came in through the nose. So it's going to be centered in the bottom part of the frontal lobes, because that's where it comes through that ethmoid bone. And you can see that brain. Do you guys see how it's red? Like it's kind of bright red. So that is actually hemorrhage or bleeding in the brain, which is obviously, as you guys know, very, very bad.
Yeah.
And if you zoom in on that, there's actually a couple spots where you can actually see pus, which is indicative of just necrotic brain tissue. So this is a brain that has, came about from the death from this amoeba. So the infection of this, the symptoms start about 5 days after exposure. That's good to know. I mean, because if you went out to a lake and 5 days later you start
feeling weird,
have symptoms, then you kind of know what it might be. We talked about the symptoms of meningitis just a minute ago. Fever, headache. What's the big one?
Stiff neck.
Stiff neck. I'm gonna make a doctor out of you. Nausea, vomiting, sensitivity to light, confusion. All right, the bad news, good news, all right? The bad news. Fatality rate of this. Any guesses?
Fatality rate.
And 0 to 100%.
90.
I'm gonna say 90.
Yeah, you're on the right track. 97.
Yeah, I know it was really high.
97%. There's only been 4 reported cases in the United States.
Died.
4 reported cases that have survived.
Oh.
Out of all the cases that have been reported of this, 4 people have survived. Yeah.
But then but then it's very rare.
That's the good news. Yeah, the good news. So that bad news is the fatality rate is extremely high. The other bad news is that this amoeba is present in every freshwater body in the United States.
Yeah.
If you go searching hard enough in any freshwater body, you can find this stuff.
So
But
when
the
you
good
jump
news,
in a pool, close your nose. Or
Well-
not a pool, a lake.
Correct. So the good news is this is exceedingly rare. In the last 60 years, okay, we have 157 known cases. So that roughly comes out to about 3 per year. But I'm convinced that the true number is probably higher because I'm sure there's some people out there, maybe live in like a rural location, jump in some lake body, and they get sick and they die, and nobody figures out what they died from. So I'm going to guess that probably cases are 2 to 3 times higher than that, which would mean instead of maybe 3 per year, maybe 10 per year, but across the whole United States. And what's interesting is the cases have increased over the years, which probably means that people are just figuring out what it was.
I can imagine like all of a sudden, like if you're, like maybe your significant other, like all of a sudden starts feeling really bad, and then you take them to the hospital, and the doctor's like, what did you do? There's nothing.
You wouldn't be like, I went to the lake, right?
Yeah, and then the doctor would be like, I don't know. I think that would be like really interesting to be like that, to be a doctor and like almost be like Sherlock Holmes sometimes. And
they're so rare that most doctors will never see one of these in their entire career. But the thing about, I think, this thing is that it's so...
I wonder how, like, if you said, like, oh, I went to a lake, I wonder if, like,
I bet they
brain-eating amoeba.
I bet they would because, I mean, even you guys who...
I guess if they had all these symptoms.
Right. Even you guys know about this. So us as doctors, we learned about this. And I think that you could probably put 2 and 2 together, or most people could. But that's a great question. And I do believe that there's probably undiagnosed cases where someone dies at home, like in their bed, and it's like, well, they're dead, so we're just going to, not necessarily do an autopsy. So I did want to have a very short section on how to avoid the brain-eating amoeba.
Okay.
All right? Because I know, Sarah, that you're concerned about this because you were talking about
I'm not going to be going to the lake anymore.
Ever again?
I mean, no, not soon, because it's like, it's fall now.
Oh, right. Well, next year.
Kind of.
Okay, so how to avoid the brain-eating amoeba. Not that this is a huge problem, but I mean, if you worry about things and you want to know, here you go. I'm not sure you're going to find this anywhere else on the internet, but right here about how to avoid getting the brain-eating amoeba. So number 1, it is more common in the South. So you want to be careful if you live in the South and you're around warm bodies of water, because as I said earlier, the average temperature in a lake where someone has actually gotten this is above 80 degrees. It does live in the soil of the water, so you don't want to get in with goggles and get into the soil of the lake and get that stuff up your nose, because that is where this stuff has the highest concentration. But it can be just in the water itself. So you want to, like you were saying earlier, don't get water up your nose.
Yes.
Now, what are some common ways people get water up their nose?
When they jump into
Jumping in the
lake,
water.
Yeah.
Jumping in the water, one. The other one people don't always think about is water skiing. Because when you hit that water at speed, the water's just like, right up your nose.
Well, yeah, I guess when you're not prepared.
Yeah, because most people that jump in the water, if they're around the water, now I know Travis, you don't like the water, right? Like you told me this before.
I gave him crap.
So we don't have to worry about Travis getting the brain-eating amoeba. Like
I'm not a swimmer.
He's not going to get the brain-eating amoeba.
I do have a question though. So since I'm not a swimmer, I'm not really like well versed in it. So this might be a dumb question, but when you get in the water and you hold your breath, like water can't get in your nose at that point, right? Or do you actually have to squeeze your nose?
You don't. So I swim a lot. I've been a water person my entire life. So if you're upright, what happens is the air that's in your nose prevents the water from going out.
Whenever I jump into the water, sometimes I don't plug my nose.
Right, you don't have to. Now most people
flips
subconsciously, if they're diving into the water, will breathe out their nose, because that will
push it out.
Yeah, because if you just go in and you're not breathing in or out and you hit the water hard enough, it can push that air back up your nasal passage and get water into your nose. So most people that are diving, they won't hold their nose, but they'll blow out.
Yeah.
But once again, things like water skiing, where you hit the water so hard, you don't always have that chance.
Right. That makes sense.
So, but and you have to be careful. Like if you're, flipping underwater, then you have to. Because have you ever done a flip underwater and water goes up your nose? Yeah, you don't want to do that in a lake. I mean, not that you're going to catch this, because, you could probably spend your whole life trying to catch this and never catch it. But, why tempt fate?
Go around snorting up
snorting up the soil at the lake. Hey, guys, watch this.
Yeah.
I don't think people are doing that, but that would be bad. Don't do that if you want to avoid the brain-eating amoeba.
Real quick, our guest producer for the day, she said that she has goggles that have, nose protectors.
Yeah, you're good.
Those make it good?
Yeah, you're good.
Okay, all right, for sure.
Yeah, because I think that the only way this thing gets into you is through your nose. And that's the only way I've heard. Like, it doesn't get in anywhere else. And that makes sense because it goes through your ethmoid bone, which I'm pointing at my face here, but there's a bone kind of at the base of your cranium where it kind of connects really close to your nasal passage, and it kind of gets up through there.
Like through your nose, that's the fastest way to your brain. Yeah.
And it's the shortest distance, yeah.
The reason why I always remember that is because that's how Egyptians used to take your brain out of your...
Right. Oh, wow. We should do a segment on mummification.
Yeah.
That's kind of medical related, is it? No?
It is.
Is it?
The process of mummification is kind of medical.
It is. We should do that. Man, you are totally giving me some great topics. You want to talk about it? I probably should talk about it, right, since it's medical.
Yeah, maybe.
All right.
I was trying to go to PA school.
I know you've told me that before. I know. I'm not doubting your medical knowledge. You do good.
No, but I'm saying that's why I like the medical topics.
Yeah, like you're all about it.
Stuff.
Yeah.
Swinging back to a conversation from earlier.
Okay.
Cindy said that I think the athlete's foot, the medical term for it, I'm gonna murder it, but it's tinea pedis.
Tinea pedis, that's it. I had the tinea, I forgot the pedis.
Yeah. Pedis is,
or did I have it? The tinea?
Isn't that like Greek for Latin for foot?
Yeah.
Is it?
Yeah, tinea pedis, yeah.
She also said the episode reminds her of Monsters Inside Me.
Monsters Inside Me.
The kids used to like that show.
Oh yeah, our kids love that show. So. All right, the brain-eating amoeba. You feel like you guys are well-versed now? You could hold a little TED Talk about brain-eating amoebas and tell your friends?
Absolutely.
That's what I'm here for, is to educate you guys and you guys watching about these topics so you know. So.
I'm way more confident now.
All right. Well, I think that's all the time we got for this week. Thank you guys so much for watching. Please leave us a comment. We want to know what you want to hear about. Please leave us a like and a subscription. It really helps us out. And we'll see you next week on Nip Talk.